My name is Kelly Patterson, and I am the clinical nutrition educator here at OmegaQuant, and I am going to be talking about our omega-3 index for pets. Let's go ahead and get started. All right, so as you may have seen, our sort of flagship test here at OmegaQuant is our omega-3 index for humans. So why would we need an omega-3 test for pets? A lot of us care a lot about our pets, and EPA and DHA, especially if you go and look out on the shelves at any pet store, there are a lot of different supplements, foods that include EPA and DHA in them, and they're used often to treat various inflammatory conditions affecting the joints, coats, skins, oral issues, and kind of general health of dogs and cats, similar to humans, but we do have very different needs. Dog and cat foods often advertise having high omega-3 or 6 fatty acids, different ratios, things like that. But it's typically these alpha-linoleic acid and linolenic acid, alpha-linolenic and linoleic acid, and they're not usually preformed DHA. So you'll see omega-3s advertised on the side of pet food bags, but it's not EPA and DHA that are typically found in there. And EPA and DHA are what make up the omega-3 index, and those are the omega-3s that tend to be more impactful for the types of conditions, especially those inflammatory conditions like joint and skin issues that we're looking for. So dogs and cats also might even have a more limited ability to make EPA and DHA than humans do. Okay, so humans can make a little bit of EPA and DHA, but not a lot. And dogs and cats may even be more limited in their ability. So it's even more important for them to get it from their diets. And in a lot of cases, because it's being advertised as omega-3s, people think they're getting what they need, but they might not necessarily be getting that. So measuring the blood levels of omega-3s, specifically that EPA and DHA, is important to make sure that your pet is getting what they need. And also it's important because we want to make sure that the supplement or the food that they're taking or getting is doing what we think it's supposed to be doing, right? So just all making sure that we're getting what we think we're getting. Okay, so what are the current recommendations for dogs and cats? This is from the National Research Council. Dogs, it's a recommended allowance of EPA and DHA is 169 milligrams a day of EPA and DHA combined, assuming a 10 kilogram body weight. So the suggested supplemental dose is 500 to 700 milligrams per day, combined EPA and DHA, or 50 to 75 milligrams per kilogram per day. Okay, so if you have bigger dogs, might be higher dose. It's all based on weight. And the safe upper limit is 2.8 grams of EPA and DHA per 1,000 calories for the dog, right? So with dosing for dogs and cats, it's a little bit different. Some of it's done by weight, some of it's done by the calories that they're eating. Again, especially in the US, a lot of us have pets that aren't necessarily as active. And so they may be taking in those lower calorie diets. They're not getting a huge amount of calories. And so we would base it off the calories that they're getting and not weight. Just depends. Cats, the recommended allowance of EPA and DHA is 7.3 milligrams per day, assuming a 5 kilogram body weight. It's a fairly good sized cat. And the suggested supplemental dose is 150 to 250 milligrams per day, combined EPA, DHA, or 30 to 50 milligrams per kilogram per day. So again, based off weight, activity, all that kind of stuff. So why would we use an omega-3 index versus just doing an omega ratio? And this is the argument we make for both humans as well, although there's a whole host of other reasons as well. But the omega ratio was kind of the original thing studied. It's a bit more difficult to explain. It's a little bit confusing, and it isn't the most clear depiction of what we're trying to assess. The omega-3 index, which was developed by the researchers who founded OmegaQuant, it's highly correlated to that omega ratio. It's a red blood cell measure versus a whole blood, so we can measure it on a dried spot card. And so we take a lot less blood. And it links directly with the interventions and recommendations by those foundations, and it's much easier to explain. It's a very simple measurement, and it's very easy to understand, right? So we're not dealing with a million different numbers that mean a lot of different things. It's a one index, and we want to know, do we want that index to be up or down? And we can provide some additional information from that as well. But I think the biggest thing here is that it requires a lot less blood because it is an RBC measure as opposed to whole blood. Okay. The omega ratio and the omega-3 index are very, very highly correlated to each other. And they're both correlated as well especially with that dried blood spot card. The dried blood spot is a valid collection measure. So this is a little bit of nerdy lab data if you're interested in looking at this, that we took from dogs. And it's an easy collection method versus having to take a whole big vial of blood, especially from a dog. Okay. Plasma measurements. So the reason that an RBC measurement is great is because plasma measurements are not viable for clinical non-fasting blood collections. So you'd have to have your dog fasting in order to get those plasma measurements be correct. Whereas with a dry blood spot and using RBC, red blood cell, we don't have to have the dog be fasting. So an omega-3 index of greater than 3%. So what's interesting and differently than humans is that dogs can have too high of an omega-3 index and too low. So an omega-3 index, this is just dry blood spot and red blood cell and plasma. So we're correlating those results as well too. So this is a randomized controlled trial on supplementation of omega-3s. So this was done on 78 dogs, and we were looking at the placebo versus triglyceride-based omega-3 supplement for dogs. And it does show that omega-3 supplementation, high quality, good omega-3 supplementation, does in fact improve those levels and get them above where we want them to be, that 3% line. Okay, and outcomes. So the level of 3% is associated with improvements in things like lameness, joint discomfort, and joint severity. Again, this is a same study. We improve those things like joint severity, lameness, and discomfort by getting those dogs up to above that level of omega-3 of 3%, that omega-3 index. Okay. This is showing that EPA and DHA in food and fish oil supplements can increase the omega-3 index, okay? So whether you choose to do a food that has that EPA and DHA in it, or you choose to do a food or a supplement to your dog's already current food, both are valid ways of increasing that omega-3 index in your pets. Okay. Dosing recommendations, again, I had that whole slide on, the dosing recommendations that can change. We are talking solely about dogs. So currently our omega-3 index for pets is just for dogs. We don't have one for cats yet. This is dosing for our omega-3 fish oil supplementation. Right here, this is the OmegaQuant suggested dosing based on that omega-3 index, okay? And this is what we want in order to get above that 3%. All right, so there are a lot of different recommendations from around the internet on what you can do for supplementation. And seeing a lot of these, this is just quotes from vets, different things around the internet. And there can be a lot of conflicting information on what is good, what is appropriate. So this is why we think getting your dog's level tested can be super, super important to make sure that we're getting an accurate picture of what they need and what they don't need. We don't want to be just throwing a bunch of supplements at our pets and hoping that it gets better. The issue, we want to take a more targeted approach. So This is the test results. This is what you would get back. Again, what's interesting about the omega-3 index for dogs, for pets, is that the desirable range here is between 3 and 8%, and it is possible to be too high. Oftentimes, a lot of folks are supplementing their dogs with a lot of omega-3s, and they're thereby not getting enough omega-6s in their diet, or they're just getting too many omega-3s and throwing off the appropriate inflammatory balance. So research has shown we want to be between that 3% and 8%, okay? We're going to get to that minimum threshold is 3%, but we don't want to be above 8%, okay? And that can be a risk with some of these supplements and the types of foods that dogs are on. So if you need to add omega-3s to your dog's diet, you can choose a food with that higher omega-3 content, although be aware, make sure you're getting something that has EPA and DHA in it, not something that has that alpha-linoleic or linoleic acid, alpha-linolenic or linoleic acid in it. Test and remeasure. So if you do change your dog's food after getting a result that shows you're not getting enough omega-3s in their diet, remeasure after several months and check for efficacy to make sure that you're getting back in that desired range. Once you're in the desired range, maybe check it once a year just to make sure that you're getting where you need to be. And then supplements, again, we want those supplements that have EPA and DHA. Again, dogs don't convert that ALA very well into EPA and DHA like humans can. And talk to your vet before choosing a product, okay? So all of this, if you're going to change your dog's food, really should talk to your vet. Once you get your results, if there's something that concerns you, also talk to your vet as well. Okay, so this is the instructions that you will receive on your kit. I should note that this is all sample collections should be done by a veterinarian. We don't want people drawing blood on their pets at home. But it is a simple and easy dried blood spot card. It's easy to collect, easy to use, easy to do. So no issues with this. And you'll get your results back within 2 to 4 weeks after using. The dried blood spot card gets put on there, put in the mail. The blood spot gets put on the card. You stick it in the mail and send it back to us, and you get your results within 2 to 4 weeks. And then you can check and see what different results or changes you need to make to your dog's diet. How do you order kits? So go to OmegaQuant.com/shop, order an at-home test kit. We'll send it home to you. Again, for these ones, we want these to be collected by a veterinarian, so you need to take your dog to the vet in order to get this done. And then if you want them to get checked yearly, just take it in when you do their annual visit. Veterinarians can also order these and do order these as well too to use for dogs in their practices. We have a different ordering process for them as well, but once you get your sample collected on that spot card, you mail it back to us, and within 2 weeks you'll get it through email, and it can also be accessed through our portal as well too. So thank you so much for listening. Really hope that this was helpful, and take a look at our other videos for our other tests.